has been scheduled and set up here with a great group of panelists that I'm really excited to hear from. And we're going to be talking about a subject that is extremely important to those of us in the workplace, and that is vaccinations and COVID-19, and ultimately what can we have our employees do, or what perhaps should we have them do, and what can we tell them and what can't we tell them, and all of that good stuff that's going to go into trying to help us make decisions as we continue to move forward and get back to a little bit more traditional working environment and so forth. And so before we get started, just want to go back through here and continue to, we'll introduce our panelists when we get started, but certainly want to thank Amy Polfrone from HR Strategy Group, as well as Cheryl Brown from Davis, Agnor, Rappaport, and Scowney, Chuck Phillips from KCI Technologies, Tricia Hudson from Hudson Coastal Raw Bar and Grill, and Bob Clare with Moburn Lighting, but he's here under their parent company, which is a Salite Group. And so thank Bob for their participation. Also want to recognize our 2021 Executive Speaker Series sponsors, which are Davis, Agnor, Rappaport, and Scowney, HR Anew, as well as also WealthSpire Advisors. And then certainly our annual partners who will be supporting a host of different chamber programs throughout the course of the year. And you see all of these companies listed on the screen here. And so certainly are appreciative of their support of the chamber. So before we get started on things, we're going to actually break out into some breakout rooms here and allow for a bit of networking or so for probably about maybe, I guess it's 12:06. So we'll probably come back in about maybe 20 minutes or so. But ultimately, we know that one of the things that people have missed is just the ability to talk with folks in smaller groups, and sometimes in larger gatherings, when you start getting up close to 50, as we'll be here, and even more, you can't do that in this type of setting. So we're going to go into some smaller groups, have an opportunity to just have some dialogue and meet some people that hopefully you have not met before. Or if they're folks that you have, maybe it's an opportunity to just get reacquainted because you haven't seen them in a while. But the other thing that, as an icebreaker, this is what we'll do, since we're obviously talking about vaccines in the workplace. As a discussion point, we'll maybe have some dialogue around what questions do you have around this subject? You know, what are you looking to either hear today, or what maybe is even taking place within your own individual businesses or companies and so forth. And as the lead host for each room, we'll do it, I guess, whoever has a birthday, maybe we'll take the youngest one in the breakout room gets to be the one that's the host to kind of facilitate the discussion. So the youngest one in the breakout room. And so with that, Taylor will be breaking us up momentarily and getting us all situated and so forth. But it's definitely great to see a number of smiling faces today and everything. I think it's because even though we got a little bit of snow yesterday, it was just enough to give a little dusting, like maybe like powdered sugar on a pastry, but nothing that was too major. Didn't hold anybody from getting out of the house, and didn't require anyone bringing out any shovels or anything of that nature. And so, all right, so we will be, I'll come back to you in about 15, 20 minutes or so. The opportunity just to be able to talk with some maybe new contacts and people you haven't had a chance to have some dialogue with before and so forth. But again, we're going to move right into the program as there's just so much to be discussed, and we certainly want to make sure that we really leave ample time for this discussion. And so I'm going to get ready to turn things over to our moderator today, and that's Amy Polfrone, who is the CEO of HR Strategy Group, and she's they're a multifaceted HR consulting firm that works with clients in a number of different disciplines. And she'll share a little bit about herself as well as the panel that you have before you. And so I'm going to turn things over to Amy to get us started here. So Amy, the screen is yours.
Thank you, Leonardo, and welcome everyone to our panel discussion today, talking about vaccinations in the workplace. We have a really impressive panel that you're going to be hearing from today. We'll be getting the best of legal insight on what we can and can't do in our businesses about the vaccine, learning the ins and outs of what we can and can't do, what we can and can't say. And also, what's really cool is you're going to hear from Tricia, Bob, and Chuck about how it's actually going in their businesses. We're really excited so that you'll gain some real appreciation for the complexities of implementing vaccinations in your workforce, as well as some things to look out for, things to prepare for. So we're really excited to share information from you. As far as questions, we're asking if you have questions to put them in the chat box, and we'll keep an eye on our chat box and try and address them as we go through. So our experts that are joining me today, we have Cheryl Brown, employment attorney extraordinaire from Davis, Agnor, Rappaport, and Skalny. Delighted to have Cheryl with us. And also we have Tricia Hudson from Hudson Coastal, a wonderful restaurant in Maple Lawn. We have, where's Chuck? There's Chuck Phillips. I'm trying to see Chuck from Senior VP with KCI Technologies. And there's Bob Clare, and he's representing his company, a manufacturing company on lighting. And so really interesting perspectives that you all can learn and get some takeaways and about, again, that's how to educate your workforce on vaccinations. Can you require it? Can you not require it? Handling the implications for field workforces or for retail and restaurants. So something for everyone that I hope that you can have some really great takeaways from today. We do welcome your questions. And again, please put your questions in the chat box for us, and we will try to keep up with those as they come in. So we're going to get this discussion started by, I want to first bring Cheryl into the discussion. Hi, Cheryl. Good morning or good afternoon. Hi there. So Cheryl, would you start us out by talking about and sharing with us what's the legal landscape on what employers can and can't do when it comes to vaccinations?
Great. Thank you, Amy. And thanks everyone for participating today. A year ago, we never thought we'd be here discussing vaccinations. Probably a year ago, we didn't quite know what was going to happen with COVID-19 either. So I am so excited to participate today and happy to share with you or answer any questions about the COVID-19 vaccinations. And the simple answer, well, it's not a simple answer. The quick answer is that yes, employers can mandate COVID-19 vaccinations. But with that said, there are going to be exceptions, and we're going to go through those today. It's kind of like in Maryland when you're at will and you can easily terminate an employee for any reason or no reason at all. There's always exceptions, and excuse me, there's always reasons that lawyers will tell you, let's think about that before we actually implement that at will statute. So with COVID-19 vaccinations, the EEOC, the Equal Employment Opportunity Commission, has issued guidance for all employers. And if any of you have already implemented flu vaccinations or have flu vaccination programs, your COVID-19 vaccination program is going to be similar to that flu vaccination program as well. So under the EEOC guidance, COVID-19 vaccinations provided by the employer or either a third-party administrator are not medical examinations, and you can mandate that those vaccinations are implemented in your workplace. When you make that decision about mandatory versus voluntary, I think after today's discussion, you'll really be able to evaluate that in your workplace and what works best for you. But a number of employees will come forward and they may share information with you as to, well, I have a disability, I cannot get vaccinated because of whatever disability I have. Or some employees may come forward and say, I don't feel comfortable getting vaccinated because of my religious beliefs. So when you hear your employees start, I guess, questioning the mandatory guidelines that you're providing, you as the employer will learn certain information about them. And that information that you're learning is protected. Under the ADA, any disability type questions is going to be protected, part of a protected class under the Title VII. So same with sincerely held religious beliefs as well. And we're going to first talk a little bit about the disability questions, because if you as the employer are actually administering those vaccinations, the CDC has basically issued recommendations that you need to ask pre-screening questions. All healthcare people who are administering those vaccinations needs to ask those pre-screening questions, such as, you know, allergies or anything like that. When you ask those pre-screening questions, that is information, medical information that you are obtaining by your employee. So once you start asking those medical questions, that's when the ADA starts protecting your employees, because you're asking healthcare related questions. So if a third party is administering the vaccination based on, maybe you hired them as a private contractor and you sent your employees out, the third party administrator is going to ask those questions, and you as the employer will not have access to those pre-screening questions. Therefore, when the third party administrator asks the questions, you don't have knowledge of any disability. So you don't have to provide any type of accommodation for those employees based on the answers to those questions, because you will not have access to that information. You want to tell your third party administrator that you don't really want to know what those pre-screening questions are, because then you will not be required by law to provide any accommodations for any disabilities. If your employees do share with you that they have certain disabilities and they will not get vaccinated, then you will have to enter into a conversation as to the disability, underlying disability, and make a decision as to whether you have to accommodate that disability. So when you look at to accommodate certain individuals, it'll be an individual basis, and you will ask, you know, you could certainly accommodate by having them work from home, but what the EEOC is saying is you don't necessarily have to have those employees work from home. You could accommodate still in the workplace, providing all the safety measures, being able to have flexible work time, wearing their safety mask, having them work in more of a secluded, I guess, office environment if that's possible. If you have any manufacturing employees, that's going to be a little more challenging, or healthcare professionals, it's going to be a little more challenging. So if you're unable to accommodate, you look at whether it provides some type of undue hardship to your organization, and then you will have to make that evaluation as well. I don't know.
So Cheryl, I'm going to jump in here to help kind of drill down this to make it real practical. So I'm thinking of a hospital, and I have a nurse, and he refuses to get the vaccination because of a sincerely held religious belief. What could be some accommodations, you know, and maybe if you want to pick another type of industry, that's fine, but what would be some practical accommodations that you're seeing your clients provide?
So it's interesting because a lot of our clients are not making it mandatory, but in the healthcare profession, and actually I'm surprised in healthcare profession, because that's one of the industries that could make it mandatory, because they have a direct threat to the health and welfare of themselves as well as to other employees. So if that employee were to come to you and ask for that accommodation, you would have to look at extra PPEs. You would look at their
Personal protective equipment.
Yes, thank you.
Okay.
Yeah. Flexible working conditions. Because remember, the healthcare workers are already working in that industry and they have already been continuing to work in that industry. So by making the vaccination mandatory, you're saying, well, maybe we're in an unsafe working environment, which is not necessarily what you're saying, but you want to ensure added protections, and this is one of the added protections that you're putting in place in your workforce, but they can still continue to work. The last resort, I mean, would be termination. And I do not want to suggest that anybody is terminated for refusing to get vaccinated, because you really should have those accommodation questions. But if there truly is an undue hardship, the EEOC allows a termination as the very last possible resort as an accommodation. But I think flexible work schedule, increased safety equipment, healthcare professionals, it's hard to maintain, safety like 6 feet apart because they're all right there. So I think you just have to continue with that extra PPE, like you said, the personal protective
Okay.
equipment.
So just continuing and or expanding the accommodations that you've been doing, because we've been without vaccinations up until now. Okay, thank you. The classic a question I'm hearing, and I'm just relieved to have an attorney answer the question: what if someone gets sick from the vaccination? What, in a mandatory vaccination, so is that then, does that trigger a workers' compensation event? I mean, what's the employer's liability for a vaccination that goes awry? A mandatory vaccination.
Right. So we've had more workers' comp questions due to the pandemic than we probably have had, in the past 5 years. And, every state is different with workers' comp. So if you're operating in different states, you have to look at each individual state for workers' comp. There is, I would say, split thought process on whether an employer is liable for mandating the vaccine. So under a workers' compensation claim, if they are performing work at that time and they're injured or there's an accident, then that's going to be covered by your workers' comp insurance. So if you're making a vaccine or even a flu vaccine, side effects from that or may or may not be covered. So I can't definitively answer that question because we haven't quite seen where the workers' comp law is going to go. There will be people who make claims under the workers' compensation policy, and you really, like I think I said in our small group, this is kind of like the wild, wild west. Without any precedent out there, we are not going to be able to make that determination definitively right now. Typically, like if you have a flu vaccine, that's not covered under workers' comp. So if you have side effects from a flu vaccine, that is not covered under your workers' comp policy. So we take our guidance based upon things that have happened in the past, and we're going to look to see what that looks like. A number of employees have made claims under workers' comp because they've contracted COVID-19 at the workplace. And that is going to be a very difficult standard to prove unless that employer is negligent or willfully, intentionally ignoring any of the laws or safety guidelines out there. And you can prove that the employee contracted it at the workplace. That's a little different.
I have a question from the audience, Cheryl, and I may need this question clarified. So I'm just going to read it. Can you register in counties in which you work as opposed to reside if you are considered an essential employee? I'm not.
So I do not know. Well, so two things. So I encourage all employers, if you can work with your local health department, to try to have the employer schedule those vaccinations for employees. If you're an essential worker, if you are able to coordinate that for your employees, if you're not going to make the vaccinations mandatory and you're going to make them voluntary, you can still provide incentives to those employees to get vaccinations. And we'll hear from our panelists on how they do that. But one incentive is to make the vaccination easily accessible to your workforce, and being able to coordinate with your local health department as to getting those vaccinations, that would be great. Of course, any individual would be able to go through their local health department as to where they live, because I personally haven't gotten a vaccination yet. So I'm assuming they ask for your address and proof of living in that county if they're going to get an individual vaccination, but I do not know that for sure.
We're seeing in Maryland as well as in Florida, when people receive their vaccinations, then they receive the vaccination card. It's, again, in Florida, a big push for healthcare workers and for senior citizens, and they're receiving the vaccination cards. And but so as an employer, again, I think what Cheryl, you said about if you're an essential service, working with your county health department is really important, and to your advantage. The easier you can make it for employees to get the vaccination, then what you were seeing is there's more receptivity to the vaccination.
Yes. And, one other point I want to make is when you are deciding whether to make it mandatory or voluntary, you can certainly elect to make certain groups of people in your office or in your organization or in your company mandatory. So, I know Bob's going to talk about his company, but he may want his manufacturing employees to be mandatory, whereas his office employees may not need to be mandatory, so they may need to be voluntary. But as long as you keep certain classes of employees the same, you can do that across the company. You do not have to make a decision that says everybody's mandatory or everyone's voluntary. You can really look at the business necessity and the health concerns that you have for each employee and base it upon that determination.
And if I may add on, also, it's really looking at the impact on the business. So the more you can maximize and give yourself and your employees the grace of flexibility, if again, for office employees, if they can do the job at home, it's keeping the viral load in the workplace lower, and being more just open to that approach until employees are able to get vaccines. You wouldn't want a failure like everyone in your finance department getting sick because they've been forced to come to work together. So continue the flexibility of the scheduling and being able to work from home again and in the office on hybrid, and as it makes sense for the business.
Right.
Would that be is that part of like the ADA reasonable accommodation consideration, Cheryl?
Well, yes, and also any type of discriminatory action, you want to make sure that you're treating the same people equally and providing them access to that. We certainly wouldn't want to provide vaccines to certain people and not others, so we want to be cognizant of that as well. I will also say if you have employees who request an exemption from a vaccine based on a sincerely held religious belief, that the EEOC defines that broadly. So you're not going to be able to ask, too many questions unless it's a religion that you're not quite sure about. You can certainly ask a little more details, but that's a pretty broad definition. So
that sounds like a call your attorney question or issue.
I would advise you
don't go that alone.
Yeah. And that's the issue, is now you have a number of, you really need to evaluate a mandatory vaccination policy, because if you have a number of people with disabilities or a number of people who have a sincerely held religious belief, now you've diluted your workforce and not that many people are going to have that mandatory vaccination. So you may really need to have a voluntary vaccination policy with some type of incentives or encouragement for people to get those vaccinations.
Well, if I could wave my magic wand, I would make it all mandatory, but I do work on Planet Reality. So I know we do have to maintain the flexibility here in approach, which I think is a great time for us to bring Tricia, Bob, and Chuck into the conversation, and just kind of starting out with how's it going in your establishments, and what are you seeing? Again, we've got a perspective of a restaurant, construction, and telecommunications company, and a manufacturing. plan. So incredible experiences to hear from. So I guess we'll get the ball rolling with, are your employees generally excited to receive the vaccinations? And let's start with Tricia, and then we'll kind of just, round robin it around with Bob and Chuck coming into the conversation.
Well, first of all, thank you, Amy, and also thank you to the Chamber for inviting me to speak on this panel to represent the restaurant industry. So, simple answer, half are excited and half are not. Our front of the house employees are very excited. Our back of the house employees, which are predominantly Hispanic, are a little wary of getting the vaccination. Right now, one of the biggest issues in the restaurant industry is that we are considered essential, yet we're in group 2. So considering how much face-to-face we're having with our guests, it does kind of put it in in my opinion, in an unsafe manner, with the amount of people that we see on a day-to-day, face-to-face level, whether it's, our cashier with a to-go order, walking a car to curbside, or eating, in-house. So, I would say right now there is some excitement. Everyone wants to know when. And so my goal is to stay in tune as much as I can in order to accommodate, the excitement, or to alleviate the fears or the concerns of the rest of our employees.
Interesting. It's, I'm sure, interesting and fascinating to watch, Tricia. Again, half your place, your employees, and some of it, it sounds like there's a big demographic split here. And so having to navigate those. We're going to talk about how to educate employees about the vaccinations in just a little bit. Chuck, what about you at KCI? Are your employees generally excited? You hearing resistance about the vaccinations? What's going on in your world?
Yeah, folks are genuinely excited about the opportunity for the vaccinations. We are getting very, very little resistance. We have people that are in, basically a lot of different classifications as far as our workers go. So we have offices all over the country. We're in 20 plus states, 60 different offices. And we have folks that work in the field every day on construction sites. We have people who work in in our clients' offices on a daily basis, doing IT related work. We have people that work as part of crews, so a field crew, 2 or 3 people working in close proximity together. And then we have, of course, general office workers who report into the same office every day. So a wide variety of people, and kind of across the board, we've gotten positive feedback on the opportunity for vaccinations.
Chuck, are you hearing more almost impatience? Like, when can we get it? When can we get it? More than it sounds like, since you're not having resistance, are you hearing impatience?
Yeah, I mean, there is some of that. And to that end, we've kind of, taken some action in that regard. And we have already contracted with a third party to come into all of KCI's Tier 1 offices. For us, a Tier 1 office has 100 employees or more. We currently have 8 of those around the country. And we will actually set up vaccination sites in every one of our Tier 1 offices to allow the employees to be vaccinated there as soon as the vaccines are available. And that's what the third party keeps telling us.
Is that third party, is this a drugstore chain or a county health department for these offices?
Not a county health department. It's more along the lines of a drugstore chain. Actually came to us through our healthcare provider, Cigna. And we use a third party contractor already for flu vaccines on an annual basis, and decided to go this way for this service. Our employees fall into either 1B or 1C as an essential business. Some of them are working on classified government projects, and they fall into a little bit different higher categories. So that allows us access to the vaccines a little bit earlier than the general population.
Great. So my takeaway from what you just shared, Chuck, is if you're not already talking to your benefits broker, talk to your benefits broker to see about eligibility for having the vaccinations on site when they're available.
Absolutely.
That's great. That is really good information. Bob, with your company, again, you're representing sort of the, we're asking our panelists to like represent not just their companies, but their industry in a sense as well. So you've got your manufacturer and you've got people all over the country, I believe, as well. So how's it going in excitement, resistance, impatience? What's the mood?
Thank you for reminding us that we're working in reality. Our reality is a little bit different from the, this Trish or Chuck situation. And that's because we're owned by a private equity firm. We're one of 5 portfolio companies, and they have adopted a hardline, straightforward approach to, to having people vaccinated. Although it's in our, collective best interest that as many people get vaccinated as possible. We're kind of agnostic. We're sticking to the CDC advisories and the healthcare advisories. We're not rendering opinion. They are extremely concerned about the developing a legal front on this, from the various fronts that Cheryl has mentioned and more, the trial lawyers. I didn't hear the trial lawyers in there, but the key is to provide our staff with the necessary resources and information, the tools, primarily that which is publicly available through the CDC website in both English and Spanish, training, what they should be doing in terms of talking to their primary care physician or their healthcare provider, or even family members, or if they have religious objections to their, to those who provide guidance in this. But we're trying to stay away from it, and we have been successful with a predominantly diverse, not only workforce but working conditions, salespeople, retail stores, manufacturing, warehousing. We have found that sticking strictly to the preventative measures that we've established early on, the social distancing, the masks, the PPE, limiting essential travel and visitors, which was impossible for Chuck's operation, and it's impossible for Trish's operation. So we've been doing all these things, staggering shifts, working from home. So it's a very comprehensive plan, but it's really simple and straightforward. Stick to the guidelines and the advisories, and nothing more, nothing less.
Okay, so a very risk conservative approach.
Extremely.
Right, and that makes sense for some companies. Are any of you, and Cheryl too can jump into, because Cheryl works with so many different kinds of clients. Are you having certain jobs that you are requiring or are any of you considering making any particular jobs mandatory?
Yeah, so on our end, we have certain clients where our employees actually report to our client site, and they are making vaccination mandatory to be able to work at their facilities. So in that case, what we have to do certainly is, offer the vaccine to everyone. If someone that's part of that work group that's working at that facility refuses to get vaccinations, we would look to make an accommodation to be able to put them onto another project. But if that is not possible, we would have no other choice other than to furlough them until either they would comply with the vaccination requirement of our client, or we could find another accommodation at another job site or another position within the company that wouldn't require a vaccination.
But as you're kind of hearing it ear to the ground, that's going to be much more the exception than the rule.
Yeah, I think that's going to be the case.
Mm-hmm. Okay, great. Thank you. Tricia, you were shaking your head. You're not going to make any position mandatory.
So right now we're following the guidance of our association, the National Restaurant Association. They are in talks. We just had a board meeting a week ago with the Maryland Restaurant Association, and we're all in standby. We're waiting for guidance. I have a small feeling they're not going to mandate it. What we have decided preliminary as again, a mom and pop, not a corporate restaurant, when we are allowed to have, parties again, because we have a back room, if somebody says, I would really prefer a server who is vaccinated, then we will make those accommodations. So let's say there was a server who was, up for a private dining and on their turn, they opted not to be vaccinated. They're probably not going to get the party because the client has asked that they have someone who's vaccinated to take care of them. One of the biggest issues that we're finding right now is obviously misinformation. Even amongst our front of the house team, a lot of them are very young. Some of them are getting input from their parents or other relatives or even their social group. How much of that is valid remains to be seen. They are very much looking to my husband and I for guidance and for information and for help. When it is time, they want to know exactly when it's time. They want to know where they can get it. So, as far as we're concerned, our job is to disseminate that information as quickly and as accurately as possible. If someone is concerned about missing a shift or losing time, we will make sure that they get the hours that they need, especially if they're going to be vaccinated. We had the same policies when we were hit with COVID. And we had to shut down for a couple of days. Our staff, they were paid. We don't want it to be their punishment because COVID was brought into our restaurant. But as far as vaccinations are concerned, to mandate them, we really are waiting for guidance from the National Restaurant Association.
So lesson learned, Tricia, be in conversation with your industry association.
Man, it is so incredibly important, especially in our industry, and I'm sure with a lot of others. The National Restaurant Association, they're the ones who are lobbying on behalf of our industry. So they'll get the news from the CDC as soon as possible. And again, we don't think they're going to mandate it. For instance, we were taking a look at some of the larger chains. Chipotle will not be mandating it. Yum Brands will not be mandating it. So, and when it comes to different franchisors and franchisees in different states and counties, those regulations are going to be different as well. So there is still a lot of uncertainty. I think it's really going to come down to the individual operator. But, the concern that we're going to have is the inconsistencies across the board with the hospitality industry for, let's say, an independent operator that doesn't mandate it yet. Next door, I have, a Panera, let's just say, and they're going to mandate it. So, really, it's our job to ensure that, our brand of Hudson Coastal is protected, that we keep our reputation as being above compliance, still on board. And, and again, right now we're kind of on standby waiting for further guidance from the national and the local associations.
Great, thank you. I'm going to bring it. We've got a few questions from our audience, and some of this may bring Cheryl back into the discussion here. We have a question. What if you have been considered by the governor as an essential worker, retail, restaurant, property management, etc.? How do you establish these workers as essential? That's part one. And part two, would this change the phase that they're eligible for given their age? So, Cheryl, come back in.
So the essential worker list, this has been ongoing since the beginning of COVID as to who has to shut down and who gets to remain open. And there's a list, and I think off the top of my head, it's probably, at least 15 to 17 categories of essential workers. If you are not sure whether you were considered essential, I would encourage you to reach out to your council or you can make, if maybe even by the federal government, you've already been deemed essential, but it's a very general list. So I know, and I know Sherry's on the call, I'm gonna use the funeral industry as an example. You know, they may not be explicitly stated as an essential worker, but they are an essential worker. So you just have to look through that list in making determinations as to whether you're essential. Now, once you have met that definition under the Governor Hogan's order as to who's essential and who's not, then you will look at the different phases, because certain essential workers will receive priority over other essential workers. So we know that the healthcare industry was essential, and the first emergency responders were essential. So they had priority over different organizations. And so, like Trisha was saying, restaurants have a different priority, and then down to, you know, even lawyers are essential. So we you know, down different levels. So you'd really have to first determine, you know, whether you're essential, and then look at the phases to determine where you fall. So I hope that helps.
I think that does. Thank you. My takeaway from your answer, Cheryl, proceed carefully, get guidance, and don't be afraid to contact your attorney or other professional advisors in making these determinations. Another question that we have, someone's husband, and this may be one of these kinds of questions where it may need some offline guidance, but someone with with health issues who has been provided guidance by his physician not to get the vaccine because they don't know enough about the long-term effects. That is there's the desire for reassurance that this employee then would not be penalized for not being able to receive the vaccination.
Right. So I think every and I'll answer it more generally than specifically, but every employee needs to evaluate their own health conditions and their own guidance from their medical provider. And if they have that confidential conversation, and again, I want to reiterate that anytime an employee discusses medical conditions, it is a confidential conversation, that they have that conversation, they can request an accommodation, and if they need to have a note from their medical provider that they have been exempt. And this would only be if the employer made it mandatory. If it's voluntary, then you wouldn't be necessarily having this conversation. But even in those situations, I do want to remind everyone that we can't retaliate against any employee who's requesting an accommodation for vaccinations or any COVID-related reasons at all. So we would not want to retaliate against that employee. So I would be pretty confident that employee would be okay, but I would encourage them to have that conversation.
Great. Back to Trisha, Bob, and Chuck. What are you doing in your companies to let employees, know the safety of the vaccinations, just how are you going about educating employees about the vaccination? And I'm intrigued with you, Trisha, because as you mentioned about your multicultural workforce and your back of the house staff being resistant and nervous about it. Can you speak to that and how you are working to overcome resistance about the vaccinations armed with good information?
So what we're suggesting, and a lot of this information is bilingual, which is wonderful. So when we overhear things that we hear are, either anecdotal or just not true, we will sit them down and just, we're not going to lecture them, but we're going to say, and we've had to do this before, this is the information we're getting. If you take a look at this, and I'll walk around with my computer and open a website right in front of them with the CDC or, the health department to show them, the information that we're getting. The other thing that, we're excited to see are community leaders, pastors. They're starting to get more information disseminated to, their community. And so sometimes we'll say, if you don't believe me, talk to your pastor. Talk to somebody who's running the community center, with your children. Because sometimes hearing it from us isn't necessarily what they want to hear, even though I'm very proud to say the majority of our back of the house staff has been with us for over 4 years. So they do trust any advisement we give them. But really, when it comes to something this personal, We definitely want them to hear it not only from us and the experts, and again, in a bilingual format, but also to talk to the people in their community.
I want to push it a little bit further with you, Tricia, because you're working with bilingual staff, cross-cultural, and concerns about undocumented, not your staff is, but they have perhaps people in their community who are undocumented, again, the kind of the community trickling out effect. About any pushback that they may hear. There's concerns from many people in the community about not wanting to get it because they're undocumented or DACA issues. Can you speak to what you're hearing about that?
So far, we haven't heard anything about undocumented. We have heard from DACA, and they're assured with the changes, and the privileges that they are, receiving with the new administration. They are feeling more comfortable in the United States right now. They feel a lot more secure. So they're actually starting to step out and say, hey, I need to make a dentist appointment, or I need to do this. So you're starting to see a little bit of that confidence and people feeling more comfortable within our country from the information that they've been hearing, from the new administration. I mean, I'm not here to talk politics, but I would say if tequila shots were not consumed the night of the inauguration, I would be remiss. They are feeling a lot more confident. They're feeling more comfortable. And therefore, some of those biases are starting to lift. And I will say also, we have some African-American employees who do feel that, they have been a little verbal and to say, this might be biased. So we just continue to encourage them to listen to Dr. Fauci and to look at the CDC guidelines and to continue to ask us because we tell the truth. Because they trust us. So again, a lot of times that comes to building trust within an organization. We don't want to be their doctor. We don't want to be their attorney, but we are somebody that they do look to for answers and for some guidance.
Okay, great, thank you. And Chuck, you talked about how your benefits brokers helped get information out. What other resources are you sharing with your workforce around the country about here's what you need to know about vaccinations?
Yeah, so very early on in this process, we put together kind of a COVID task force made up of folks from different levels of the company in our HR group, our legal group, and to disseminate information. And we push out communications on a weekly basis through multiple channels. It goes out through emails. It goes out through, in some cases, mailings, where we have folks that are remote in field situations. We push information out through employee supervisors, and then we do town hall meetings. And one of our town hall meetings each month is reserved only for COVID topics. Because we are in so many different states, there's a lot of different information that changes state by state on what's open, what's closed, what can you do, what can't you do. And we've had to, basically have channels set up to sort through that information, push the information out to our folks and make it readily available. Luckily, because of the industry we're in, we have a very robust communication system as part of our business. So we're able to, very easily make contact with our employees, whether they be working remotely at home, working in one of our offices, or working on job sites. So we haven't really had too hard of an issue getting information to them so that they can, digest that and kind of make up their own minds on how things are moving forward.
That sounds like total best practices going on there.
We try.
Organized centrally, and then the information pushed out quickly and regularly and consistently.
Correct.
Excellent, thank you. And Bob, how about you?
Well, on a much smaller scale than Chuck's, we have a fairly regular communication process, not only between me and the other COVID coordinators of the private equity portfolio, but also among our division leaders every week. I just posted, for those of you who have never seen it, the link to the CDC website, and it just shows one of the tools that's available in very simple, straightforward form. What we've done in the past is taken this information, massaged it a little bit to make it a little bit more conducive to our workforce, had it translated into English and Spanish. We've done PowerPoints for town hall meetings. The key for us, however, is to really arm and educate our managers and supervisors because those are the people who the people come to. They're not going to come to me necessarily. I'll be the last one to hear about it if there is a question or a circumstance that needs to be evaluated. So it's more key for us to train our supervisors and managers to be able to handle the questions out in the field. And that's been very, very effective for us. But we have a lot of small businesses here. All this material is readily available at the CDC and it's updated regularly. There's a lot there, but it is available to you if you need something handy to post, in a workroom or in a bathroom or, as you come in. So it's worked for us.
Excellent. And
I just want to reiterate what Bob said, and you probably were going to reiterate too, but with the supervisors and the managers, one of the reasons, and I think Bob touched on it, and it's so important, is that they can attach liability to your organization. And if they're not educated as to, what your policies are, what your procedures are, how to recognize an accommodation request, then they can attach that liability. Because like Bob said, they're going to come to the supervisors and managers before they come to HR or to the president of the company. So that educational piece is just as important for your own employees and staff. So thanks, Bob.
You're welcome.
if any of you have any questions that you would like our team of experts to answer, feel free to put them in the chat room and we'll get to them. Since I still see it, I'd like to just always ask about, are you still seeing any resistance from employees about COVID in general, and especially around adhering to safety protocols, masks, or my pet peeve is the half mask, social distancing, et cetera. Are you still seeing these, COVID acceptance or resistance in your workforce? And what are you doing when you see people not adhering to the basic protocols and safety protocols?
Well, from our standpoint at KCI, we enforce the protocols. If anybody is in a common space in one of our buildings without a mask, they are, removed or asked to leave the building. You don't get into our buildings without having, proper protocol in place. Our headquarters building, we have installed units that actually measure your temperature, so you can't get through the door without having your temperature taken. The doors physically won't open. And then, as I said, in all common spaces, you have to wear a mask. If you're in your individual office and away from other people, we allow masks to come off, such as my situation today. I'm sitting in my office with a closed door. But once I leave this door, I have to have a mask on. And if I didn't, somebody would pull me up. We have people that think they're the COVID police in every one of our office. And believe me, they will fight you. They're looking for a reason to throw you out. So we haven't really had any issues there.
I love it. Hire me for that job. What about half maskers? Is this COVID, your COVID cops? Are they enforcing the half maskers? Like, pull it up?
So I'll say we've got twofold. Number one, our staff, they're so paranoid about getting sick because of the amount of people that we're around that there isn't even a question about masking, about anything else. Everyone's hands are nice and raw from the amount of sanitizer we use. We're very visible in front of our guests with how we handle either touchless menus or complete sanitation. We installed UV filters in our restaurant. So it's actually, I've had people comment, they say they feel the air is fresher in our restaurant than in their own house. You want to talk about police, social media has made it very difficult for restaurants to not follow protocols because you will be called out on social media. In Howard County in particular, there is a Facebook page of about 1,000 members, and it's the Howard County Eats, and it's a wonderful Facebook page, but it's also the COVID police. I'll be honest with you, one of the biggest issues we're having are people coming in from other counties. A lot of the counties around us are closed to indoor dining. So for some reason, they feel in Howard County, even though we're open for indoor dining, it's okay to walk in without a mask or to stand up and go to the bathroom without a mask. So we have actually invested in more signage, larger signage about masking, and almost to the point where it's obnoxious. But for us, we don't want to serve anybody without a mask, and we don't want anybody employed or interacting with our guests who are not following proper protocol. Everybody is temped upon arrival. We have a HEPA filter in the front. And again, there's no excuse for not having what they need because if for some reason they forget a mask, we've got one for them and they cannot work or be on our floor without it.
What about your guests who won't mask?
So
any mask resistors in your clientele? Absolutely.
But what we say very politely is we are so fortunate to be open here in Howard County, and we'd like to continue that. If you love our restaurant, could you just do us a favor and just put your mask back on? And we'll tell them, because it's true. The health department is walking around unannounced, and people will call you out on it. I had I shared an anecdote earlier that this weekend we had a gentleman that was questioning a guest whether or not our tables were 6 feet apart. And my husband brought out a tape measure and showed we are following proper protocol with 6 feet apart. So people are becoming a lot more emboldened within the public to make their comments either known on social media or known to the people who are running the restaurant. We've been very fortunate we haven't been called out because we're following protocol. But when I read some of these comments on social media, I cringe. I absolutely cringe. So, public perception right now is also a big driver.
It's regionally too. Mid-Atlantic is doing more with adherence to the protocols than.
And with that being said, I'm sorry, one more comment. We have a residence inn right next to us. And so we get a lot of, we're starting to get more and more people stay at that Marriott, and they'll come to the restaurant, sit at the bar, and a lot of them have absolutely no clue what the laws of Maryland are. So, we're also educating people coming in from other states about, what is expected from us and what's mandated by us in the state of Maryland.
All different levels. This onion just keeps getting pulled back. Got a question from the audience for you, Cheryl. Cheryl, you mentioned a suggested insurance coverage in addition to workers' compensation. What is the correct name of that insurance coverage that employers need?
So as we navigate, I think, this new wild west with COVID-19, and we're unsure as to what claims may be made, I would encourage everyone to revisit your insurance and look at your employment practices liability coverage. So it would be an additional coverage. It covers your discrimination claims of retaliation, wrongful termination, harassment, anything like that. So that would be something that you may want to revisit again if you're concerned, or if you're in an industry that possibly is more susceptible to claims by employees, then you definitely want to look into that type of coverage. I did want to follow up with the answer to your previous question that you had to everybody about what we're seeing with our clients, and some clients who may be a little more lax with their, I guess, safety measures. They are finding that if you're in the world of government contracting, or if you're working with other organizations, they will have to follow their guidelines. I've had clients who are, refuse to walk on site because they're not, they don't have the proper mask. And also that would go with the COVID-19 vaccination. So whoever you're contracting with, or if your employees are working off site, look at that company's requirements, because you may, although you may be a voluntary vaccination provider, or your mask requirements may be somewhat different as dependent upon where you work in the country. The organization that you're contracting with or your employees are working with have stricter compliance that you need to comply with. So you need to look at that as well.
Always outstanding guidance from Cheryl Brown. Thank you. Our chat box is quiet right now. So I'm going to do a little bit of wrap up and then turn it back over to Leonardo for kind of our closeout. But thank you all so much for being a part of the discussion today. For most of you, you've been in listening mode, but thank you for listening and paying attention to this. We know there's going to be more and more and more vaccines coming, and the more we can, I think we can use Chuck Phillips in the KCI model. Communicate constantly. Keep this on your radar screen. Keep it on your employees' radar screen. Until we get the vaccine, of course, continuing with the COVID safety protocols that we've become used to. Again, think about a year ago, this COVID wasn't even on our radar screen really at this time last year. So look how far we've come, and still keeping in mind, look how far we need to go. But we are getting there. Light is at the end of the tunnel. So to quote both the Baltimore Mayor Brendan Scott, put your mask up, shorty. So let's keep our masks on and keep it going, and keep the information flowing to your employees about the importance of the vaccination. And this is how we're really all gonna get back to work, which is what we all, I think, are really excited about. So with that, Leonardo, thank you for having us here to join you in being a part of the executive panel. We really, on behalf of the panelists, we really appreciate the opportunity to share with everyone here.
Thank you, Amy, and thank you again to the panelists. Phenomenal job, very informative. And again, the one thing that I think that I said when we had our, our prep call was just the fact of, you can just really see how implementation of vaccines and so forth, how it just really varies based upon industry, based upon location in the country where you may have multiple offices and so forth. And so obviously, I think as it was touched on, certainly have good counsel, as well as also being able to really be a part of various industry and trade groups that you can really go to for information and so forth. And so again, thank you all. So before we wrap up, I want to just share with you all a few things again that are forthcoming. And so the first thing being here, upcoming events. And so we'll have our first Business After Business event next week, which will be virtual. And it's going to be using a different platform. For those of you that have participated in our YPN events, you've become accustomed to using Blitzer. But this will be the first time we've used it for the General Chamber and one of our programs. And so what Blitzer allows you to do is actually have one-on-one networking for an allocated period of time before it then rotates you to be able to talk to someone else. And so it's kind of like speed dating for business people. And so certainly encourage you to join us on February 2nd. It's free for the first 25 registrants. And so, again, another way of being able to network and so forth. And then also on that same business development note, many of you know John Dinkle, who was formerly the head of the BBJ. He's going to be with us and talking about business development in the new economy. And so this is part of our Ask the Experts segment. And so really talking about, again, how you can continue to network and drive business. And this is actually two parts. We'll be coming back in a couple of months with someone else that's going to be talking specifically about how to better leverage LinkedIn. And so for those of you that attended our women's conference, you will recall, and I'm drawing a blank on Bianca's last name, but you know what a phenomenal job she did at our women's conference. So we'll have her back in April to be talking about ways in which you can truly leverage LinkedIn from a business development standpoint. And then also our State of Business with Dr. Ball on February 24th. And so And then our YPN, our Accelerate series, the first session is coming in. And so talking about skills development and particularly understanding what skills you may have that's transferable. And then the fourth session in our cyber risk management series, which also is going to be on the 25th as well. And so, again, a lot going on. The month of February is going to be extremely busy for us, but certainly thank all of you for joining us today. Thank all of our speakers once again, as well as our series sponsors and our 2021 annual partners. And I would say for those of you that are participating, if you're not a member of the Chamber, we certainly would want to ask for your business and to have you join us. Virtual or not, we're still working for you here in Howard County. And so thank you again and have a great rest of your day. Be safe.
Thank you.